Hello, everyone. Happy Tuesday, and thank you for joining me. I am your host, Dr. Terrelyn, a board certified family physician, speaker, author, and coach, and I am passionate about helping physicians navigate the next steps in their career. And the purpose of this program is to showcase extraordinary physicians doing wonderful things in and outside of medicine. My guest today is Dr. Toya. Thank you so much, Dr. Toya.
Yes,
And
thank
just
you for having me.
and and just to tell you a little bit about Dr. Toya and our important topic today, which concentrates on supporting and empowering mothers in their fourth trimester, which is the postpartum period, we have Dr. Toya, who's a board certified OBGYN. And just a little bit more about her is she's known as Dr. Toya on social media. She's a wife, she's a mother, and again, she's a board certified family physician. Excuse me, a board certified OBGYN. She was born and raised in Trinidad and Tobago, and she journeyed to the US where she earned her bachelor's and her medical degrees from Howard. Yay, go
Yeah.
Howard. She did this in 6 years, y'all. So Dr. Toya is a beast. She completed her residency training at Pennsylvania Hospital in Philadelphia, and she has lived in Northern California since graduating from the program. She uses her social media platform, Dr. Toya OBGYN, to empower women to take charge of their reproductive health and advocate for themselves. She is a coach of physician moms who are postpartum and beyond, helping them go from overwhelmed and disconnected to confident and fulfilled. We are so happy to have Dr. Toya here today. Thank you, Dr. Toya.
Yes, thank you so much for having me. I am excited to be here.
We have a really, really important topic. And I know it's important not just to you as an obstetrician gynecologist, but also as a mom.
Mhm.
I'm also passionate about it for the
Yeah.
same reasons. And I think it would be great to start with tell us a little bit about how you journeyed from becoming an OBGYN to
Mhm.
your current passion and position as a physician coach of postpartum women.
Yeah, so it starts, let's see, maybe 2019 was when I started my last employed position. But even before then, I had already suffered one burnout, which was residency, which I'm sure is very familiar to many people because residency was tough. And I was very unhappy there, and I told myself I am never going to feel like that again. So I went out into the world, had one job, got this next job in 2019, and it was fine until it wasn't. So it suffered from like chronic understaffing and all of these issues. So then I found myself getting burnt out again. But I was in true survival mode. So I was just going along doing what I had to do until I decided that I was going to start a business, which was during the pandemic. Like many people, I was like, you know what? Life is short. Let me start a business while I am fully employed. So I decided to do that. Oh, and I had a 1 year old. And while I was very busy and through all of the lessons that I learned through entrepreneurship, I realized that I did not have to suffer through this job, right? I knew my value as a physician and what it meant in the world at large. And I had so much to offer and I could always make money. So staying in a toxic environment just for good benefits was not necessary. So I actually quit my job without a plan. I didn't have another job. I didn't have anything lined up. I was just like, I'm going to figure it out because I know I can. And so I took a couple months off and then I started doing locums and just doing like laborious coverage. Got pregnant, had a baby. And then during that postpartum period, it was very tough, unlike my first one when I just went back to a regular job. Because I was doing things that I really loved in this new entrepreneurial role, speaking and social media and all these things, I kind of went back very quickly and before I was ready. and before I was fully recovered from my postpartum experience. So while I was doing all these things, I became very resentful, and I was angry that nobody was taking care of me the way that I felt like I should be taken care of. But that included myself, right? I was not doing what I needed to do to make sure that I had the care that I need. And I also wasn't telling anyone. I was just angry. So it came to a point where I kind of hit a wall, and I had to cancel everything that I was doing. And I told my husband, I am going to take a break. I'm going to go away for a little bit. Y'all stay here. I will see you back in like a week or so. And he was like, what? No, you're not going anywhere. So we ended up going on that trip because I was serious. I had tickets and everything. Going on that trip together, kind of figuring things out, reconnecting. My sister came from Trinidad to help my mom with the kids. And I really, kind of turned things around and started taking care of myself and prioritizing my health and my recovery. And through that experience, and then the continuing experience of needing to make sure that I was continually taken care of, starting with me first, I really wanted to help other physician moms in the same way, because while the things that I speak about are really universal, any mom needs to hear these things and can implement these things to improve their postpartum and motherhood journey. Physician moms really have a very unique set of challenges that I feel like only another physician can understand. And I really wanted to serve my colleagues and really get us, doing better in this time. I had a client that told me she didn't rush to the OR when they called her emergently. She stopped and peed, and she was so proud of herself because she hadn't peed all day. Like, that's something that not any other specialty or profession, I should say, is going to really understand. But like, why is that a big deal? But for a surgeon, that's a big deal, that you take care of yourself and you stop and you use the bathroom. So there are just certain needs that physicians have that I feel like I can address and help with. So that's how I am. That's how I came to this point.
Thank you so much. Now, I want to highlight a few things that you said that were very important that I don't think that we do enough of. And that's one, you stopped, you said, okay, this is not working for me.
Yeah.
That takes a lot of courage, especially when we have a family, we have all of these responsibilities. A lot of times we stay in an environment that's not healthy,
Yeah,
because we're afraid. And what we don't realize is, if we don't take care of ourselves, like you said, then our patients suffer, our families suffer, and everyone else suffers.
Yeah.
So I want to applaud you, and hopefully you'll inspire others, not just physicians, but other moms, other women, other people, that when it's not right, it's okay to take a break, because your mental health, which also affects your physical health,
Yes.
is much more valuable, much more value. And if you can take some time off, if you are financially able. So thank you for sharing that, because I'm sure that has helped someone else
Yes.
know that it is okay. So I love that it's not that far from what you were doing. You're already a healthcare professional of women. You take care of women, you take care of moms. So this wasn't that much of a leap. You were able to, it sounds like you were able to move to concentrate on a particular area, a particular group of people that you felt passionate about serving. And I love that. So I have a question about the postpartum period, or what we call the fourth trimester, which would be those 12 weeks, those critical 12 weeks right after a mom has the baby. And I was astonished to look at the long list of concerns that we should take note of. And I didn't even think about that. I'm a family physician, but it's just, one, it's a miracle that the baby gets here. It's a miracle that mom is okay. But when you think about all of the issues that you still have to monitor right after the baby is born. So listen to this, y'all. If the weight retention, depression, issues with lactation or breastfeeding, Urinary incontinence may be a problem, low libido, low self-esteem. And if the patient already had issues with cardiovascular disease like hypertension or diabetes, whether they had it pre-gestational diabetes or they developed gestational diabetes. And the list goes on, and it never occurred to me that you aren't just delivering the baby, but when you see mom back, you have to address all of these concerns. So just tell me, and I have one other thing that really astonished me, and that was I didn't realize that 40% of women don't go to their postpartum visit. That's almost half. And when you think about it, that's amazing. And it's also very concerning because the care that they need is not just during when the baby is born. The care needs to continue. So I want you to talk a little bit about that postpartum period and what you focus on and how you help women move through it as seamlessly as possible.
Yeah, so I love that you talk about that because it's something that people don't know. Everybody assumes, oh, you have a baby and then everything's fine. But there are certain conditions that are actually more likely that, they're going to be more dangerous for you after you have the baby. Certain things that will go on during the pregnancy that can still happen, even though it's due to the pregnancy. So like preeclampsia, you can have a seizure after you have the baby. So it is still a very important time for care for the mother or the person that just gave birth. And the more people that know that, the more kind of bad outcomes we can prevent. And that's why having more touch in that postpartum period is important. And we're kind of moving out into that as OBGYNs, where it's not just, oh, we'll see you in 6 weeks. If you've had blood pressure problems, you need to be seen within 5 to 7 days. If you've had a C-section, you need to be seen within 2 weeks. If you have high risk conditions like that, there's more. And then in general, we're making it so that everyone will be seen at the very least at the 6 weeks, if not before, because there's so many things that we are missing. And especially in the mental health arena, when they fill out those forms, actually looking at them, reading them, and doing something about them. So we have a long way to go in the field of obstetrics. A lot of times, pediatricians and family medicine physicians who are seeing the babies have more touch, so they can catch things, and they're an important screening tool for moms for mental health disorders and other things. I've actually heard of pediatricians catching like high blood pressure, and they send them up to us because the mom was there for the baby and she didn't feel well. So it is very important to make sure that she is being seen and really being seen, not just as a person that just had the baby and now the person that's making milk. Like she is more than that, and she needs recovery and rest. And that's something that I feel like as a society, we do not focus enough on. And the reason that most people don't go for well, not most, 40%, which is a lot, don't go for that appointment is because they feel like it's a waste of time most of the time. So there are certain barriers. We live in the United States of America, capitalist society in 2024. Some people don't have childcare. They don't have time off for the job that they already had to go back to, things like that. But a large proportion of women feel like it's a waste of time because all they get is, you good? What birth control do you want? Oh, you fill out this depression screen, you're depressed? Yeah, that sucks. It gets better. Bye. So it's just like, their whole TikTok videos about how people don't even get exams and, all they get is the birth control talk and things like that. So it is on us to educate people about the importance of the follow-up. And then when they actually come, to do something, to do what we're supposed to do, to make sure that we're taking care of them, because we all know the statistics about maternal morbidity and mortality, and that does include postpartum. And in general, one of my soapboxes is realizing that postpartum is 1 year after you have the baby. Mm-hmm. So a lot of people focus on that 4th trimester, the first 12 weeks, and it is very important. There are unique challenges that people who give birth face during that time. But there's still challenges up until the 12-month mark. And especially in the mental health arena, the peak of postpartum depression is about 6 to 9 months after you had the baby, right? And if you think about it, that's when a lot of the support goes away, right? The family goes back wherever they came from. You transitioning back to work, the baby is more active. People expect you to bounce back and to return to normal life. So if you are already not feeling great right after the baby and you're waiting, you just, maybe it'll get better, maybe it'll get better. You look around, you have like a crawling baby and you still don't feel well, and that's when those rates of death by suicide go up, and all of these, we have these poor outcomes. So it is a time that I feel like is kind of forgotten. And I really am passionate about making sure that we know that we still need care past, those 12 weeks.
I'm glad that you shared your story and what you're passionate about. I have a couple of other statistics for you that I want you to just shed light on, and that is, we talk about how high the maternal and maternal and child mortality rates are, but I was just astonished to learn and this is from the Kaiser Family Foundation, that now we knew that Black and American Indian women suffer more pregnancy-related outcomes, complications than white women, but I didn't realize for Black women it's 3 times higher, and for American Indian and Native women it's 2 times as high.
Mm-hmm.
Why do you think that is so in a country as rich as the U.S.?
Yeah. So the answer is simple but unfortunate. It's because of racism. So to be very clear, not because of race, but because of racism. And I think it's good now that, ACOG, which is our governing body as OBGYNs, and everyone else is really acknowledging that there's a difference there. Because when we were growing up, my husband always tells me he would see on TV, Black people are at higher risk for XYZ. And but why? There's always this sense that it's because you're Black, like there's something genetically wrong or deficient or whatever. But we are very clear, well, we were clear then, but now it's becoming more widely accepted that it is racism. It is the systemic racism that exists in this country and the world, in a structure of white supremacy that causes these disparities. And once we talk about that, we acknowledge that, then we can work towards rectifying it. If we act like that's not the reason and there's something else, we're just going to be spinning our wheels and the numbers are not going to get any better.
Thank you for that. And we have seen more campaigns like Listen to Her and a lot of other celebrities using their platforms to speak out. Like everybody may be familiar with Serena Williams, but you mentioned yourself how you didn't feel like you were getting the type of care postpartum that you should have gotten. And certainly I can share in that when it comes to pain control, that was an issue for me with my 3rd C-section, where it didn't matter that I was a physician. It didn't matter that I had been in that hospital before, delivered with the same physician. It didn't matter that this was my 3rd child. When I said, hey, this is, I'm having a lot of pain here. And I was questioned more. Are you sure? Do you really think you need the narcotic? Like,
wow.
Why don't we just give you ibuprofen for right now or Tylenol right now and see if that helps?
Yeah.
And I'm saying, no, this is real. And I shouldn't, and I was in tears, and you feel so vulnerable at that time. And it's so true that it does not matter. Socioeconomic status does not matter. And so I'm so glad that you are empowering women to speak up, because it is a vulnerable time.
Yeah.
And sometimes we don't know how to advocate for ourselves. So how can, if we want to get in touch with you, if we want to become a client of yours so that we can get all this great knowledge and coaching, how should we contact you?
Yeah, so I can be reached on my website at drtoyacoaching.com. So that's DRTOYA coaching.com. And all the information is there to work with me. And if you are a physician who's transitioning back to work, or you're even pregnant, which is better because you can plan, and you want some helpful tips, I have a list there of 7 tips to help you go back to work and make your transition less painful. So you can download that document there and really help you, because that's really my goal, right? Is to make sure that other moms don't have to go through what I went through, um, and also learn from the experience of having taken care of women in the postpartum period for the last decade.
Can you give me that website again? Is it at drtoyamd.com?
No, so it's DRTOYA coaching.com. So drtoyacoaching.com. Yeah.
Okay.
And then if you want to follow me, I am at Dr. Toya MD on Instagram, and TikTok is where I do my patient education. It's Dr. Toya OBGYN. I have a lot of platforms. Or you could just search for me on Facebook with my name, LaToya Luces-Sampson, and same on LinkedIn as well. And I also have a YouTube channel. You can find me just type in my name and I'm everywhere.
Well, I want to encourage folks to really to start following you, because you give some great tips, and I feel like you're so real. I was sharing with you earlier that I love when you post. You posted a picture of yourself 2 days postpartum. Like,
Yeah.
that was great.
Yeah. That'll be all.
Yeah, that was awesome. And I know that you give commentary on things that people put out there that are just not true.
Yeah.
And this is why, folks, that you really need to listen to a board certified physician, and especially a board certified obstetrician gynecologist, because this is how you know that there is a governing body that says that this person is qualified to give this information. So, Dr. Toya, you've given us so much info. Guys, take your time, follow Dr. Toya right now, whether it's on TikTok, whether it is on LinkedIn, and like she said, she is in some places she is LaToya Luces. So whether you find her at Dr. Toya or LaToya Luces, then please follow her, because she gives great information. Yeah. Is there anything else that you want to leave us with that we may not have covered?
Yeah, just, I speak to pregnant women and postpartum women about, the care that they need and what they should plan for. But I also want to encourage anyone, if that's not your season, or if you don't have the ability to have children, these messages are still important for you, because you are the ones that will be caring for her, right? You will be around her. You are her village. So making sure that you are seeing her and knowing that she needs your love and your support even after 12 weeks is important, because she can't do it alone. She needs to have that support. So just keep that in mind. And if you can't have children, still follow me anyway, so that you can get all the tips, so that you can take care of the other people you love in your life.
There's one thought I want to leave everyone with, and I got this from you, and that is normalize mothering mothers in the postpartum period. I love that. So I'll say it again. Normalize mothering mothers in the postpartum period.
Yes.
Very profound.
Nothing else to say. That's it.
Thank you so much for joining us. This has been enlightening for me. I always learn something. And folks, again, please follow Dr. Toya on all social media platforms, and you can look her up also by her name, Dr. LaToya Luces-Sampson. Let me also say, thank you for joining us. You can catch the replay on Instagram, and share it with your friends, because again, you are part of someone's community, whether you are having children yourself, you are a mom, or you are related to a mom. So you are part of the community. So share it, continue to follow us. And I'm signing off. I'm Dr. Terrellin, board certified family physician, speaker, author, and coach, and I am passionate about helping burned out physicians navigate the next steps in their career journeys. And I do this through programs like this, where I also just educate and show all of the endless possibilities that you can do in medicine. So thank you again, Dr. Toya, and we'll see you on social media. See you on TikTok.
Thank you so much for having me. Bye.
Okay, thank you. Bye-bye.